Hello, my name is Di Mu with the Washington State University team, working in collaboration with the Extension Collaborative on Immunization Teaching and Engagement, or EXCITE. This is a supplemental material for the Applied Neuromarketing Science training modules as part of the Getting to the Heart and Mind of the Matter Toolkit. There are many other modules for you to use to help you learn from this toolkit. You can watch any of our other videos about motivational interviewing, science media literacy, or neuromarketing by clicking the link to each of the modules in the description.
So during last year, we conducted 2 rounds of data collection for this EXCITE project, and we used neuromarketing-based message testing methodology, as Paul mentioned earlier. So the 2 rounds of testing happened in August 2022 and October 2022. So we attended 2 extension conferences for this testing. One was the Association of Extension Administrator, and another one is for the 4-H use and development. So we had and so that we have more participants from the field during the testing. So you can see on the picture, the picture on the right side, that was taken from the on-site data collection, and participant was wearing some equipment on his hands, arms, and forehead. So they were able to use the laptop and browse messages as they would normally do. And all these things belongs to Rural Mobile Media Mind Lab, as Paul mentioned earlier. So if you partner with a neuroscience marketing provider, the settings will be similar to this as well. So all the equipment's wireless, so that you can carry the system with you and do on-site data collection whenever and wherever you want. So for example, we collect this data just in the hotel room. Okay, so this is the background. So the objective of this message testing project was to identify visual and text content elements that are likely to effectively engage extension professionals in effectively responding to extension COVID-19 vaccine messages. So there were 2 sets of vaccine messages context were tested. One was for visual, and we tested for different emotional tone, like the level of pleasantness, and the second one is dominance of vaccination cue. And this content was for the other content we tested with textual framings, which ties extension professionals to vaccine education through different emotional appeals and extension values. So the pictures and messages on the right side were the stimuli we tested during that project. And the method we used was based on neuromarketing science, and we collected heart rate, skin conductance, and facial AMG, which indicates cognitive attention, the intensity of the emotion, and the valence of emotion, respectively, along with some other self-reported measures. So, for example, we also asked our extension professionals the perceived message effectiveness, like how favorable or desirable do you think the message would be perceived to be, or how willing or comfortable do you think you might feel if you were choosing to engage in vaccine education as part of the extension professional mission. All right. So now I'm going to present the actionable insight from the project result. So first, let's look at about the visuals. Effective vaccine education content begins with brain-friendly visuals that capture attention and elicit a mixture of positive and negative emotional responses. So evoke positive attitudes such as favorable, desirable, likable, informative, that will enhance the mental processing of text. Here are some 2 examples of brain-friendly visuals. So on the left side, that one is highly effective in terms of elicit positive emotions and attitudes. So the pictures on the right side is moderately effective, but you can see both of the picture had a pleasant emotional tone, and you can see the level of presence of vaccination cue is not. You can see a low level on the left side, you can see a high level on the right side, but which means the level of presence of vaccination cues not that matter, but what matter here is the emotional tone. So pleasant emotional tone is quite important. And then we can see here are two examples of brain unfriendly visuals. So first, we definitely want to avoid the combination of unpleasant emotional tone with high presence of vaccination cue, which is on the left side, in any format of the vaccination education. So at the same time, on the right side, you can see the high aversive with low presence of vaccination cue is more like a double-edged sword. So our empirical data from both neuromarketing science method and also self-report methods showed that highly aversive, like unpleasant content, effectively attracts attention to some extent. However, it will also evoke negative responses towards content, and the content seems less desirable and favorable to the audience. So use it probably with caution. All right. So for next, let's look at some actionable insights for brain-friendly textual framing. So we said brain-friendly if that text messages engage attention and emotion in a way that enhances memory or learning for content, lowering negative feelings ties to vaccine education, as well as increasing self-efficacy related to engaging in vaccine education. So the two primary framing strategies for extension vaccine education we tested were emotional frames and extension value frames. All right. So here is an example that we found it most brain-friendly and emotional framing in terms of letting extension professionals feel more willing and comfort for doing vaccine education, and also better on cognitive engagement. So that is showing empathy for constituents through their work. It says like extension professionals can be equipped to deliver vaccine education in a way that treats individuals who are afraid of vaccination or paranoid with respect and does not involve intimidating, humiliating, or even persuasion. So extension should avoid a severe complex, especially in rural areas. All right, so the second emotional framing that we think is effective, which is the pride in expertise. So we recommend use this framing as an alternative framing to the first one. And here is an example for how it frames. So extension professionals have the opportunity to feel pride in their expertise used to educate their community and have a tremendous ability to understand vaccine and the science behind them. So extension has a history of providing vaccine education, and we can be proud to engage in programs that lead to more thoughtful decision-making. All right, and also all the actionable insights are actually available in the toolkit as well. So from page 108 to 192, so you can also reference to the toolkit. And here are the example of brain-friendly text measures that using extension value framing, which we created from the extension professionals grades. So we highly recommend this framing. It was the most effective one, which is that extension is a link between the people and the ever-changing discoveries produced by expert scientists. And for this one, beliefs in intellectual freedom, we recommend use it on a light rotate as an alternative to the first framing. Okay. And here are two examples of brain unfriendly framing, which we probably want to avoid. So the first one is saying education is basic in simulating individual initiative and self-determination, and the other one involves the vaccine education fits the mission because we believe in the opportunity we have to make our lives and the work we do useful to humanity. So these two framings relatively evoke more negative emotions and reactance towards vaccine education. So probably when we do the promoting our vaccine education, probably avoid these two frames. All right. So the very last thing for me to present for this project is the neuromarketing project is the sample message template script, or we can call it a creative brief. So this is just an example of an application, but it's not an example for a flyer or something. So it's just give you some idea about what you can say for brain-friendly communication or what images that you may use in your creative work. All right.
Thank you for watching this video. If you would like to learn more about neuromarketing science training modules, please check out videos from Dr. Paul Bowles in this toolkit. And finally, thank you for watching and learning with us today. Again, we would like to thank the Excite Foundation through its interagency agreement with the USDA National Institute of Food and Agriculture and the Centers for Disease Control and Prevention for funding this project. We hope this toolkit is helpful to you and your communities.